this program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Statements in this program have not been evaluated by the FDA. As an empowered individual, you do have options available. We're honored to continue and share the teachings of the founding father of science of epigenetics, Dr. Joel Wallach. Okay, let's go ahead and get this show going. So excited, sorry. Let's go ahead and open up the door because yes, we are live. We have a live audience and I'm super excited as today we're going to be discussing some things that don't come together usually in one conversation. So we're going to be covering a lot today, folks. Make sure that you are ready to take notes. If you are live here with us in the Zoom, which you can access, can then take your notes without missing a beat and listen. That's the best part. Listening and taking that information, putting it into action. Well, folks, my name is Becca Dukes. I'm a certified holistic health coach, a certified naturopathic practitioner, and the director of student services for the Institute of Holistic Health. I am also the producer of this show, Daily with Doc and Becca, and it's my honor to have this show as a resource to an amazing community of people who have found the importance of nutrition and want to. Folks, we are not chemical deficient, and in most cases, it's not hereditary. We're nutrient deficient. Well, today I'm excited as we Dr. Laura Dennison, and we're going to be opening up a conversation that affects every adult and some children, teens anyways, yet is rarely talked about, like I said, in one room. Hormonal transitions don't just impact women, boys. They impact men and women, families, relationships, energy, mood, metabolism, and long-term health. And yet, these conversations are often fragmented, minimized, or misunderstood. So joining us today is Dr. Laura Dennison. She is a naturopathic doctor, holistic health educator, a master herbalist who helps people understand hormone balance through nutrition, herbal medicine, and root cause healing. Today, we're going to be diving into perimenopause, menopause, postmenopause, and hormone balance, and expanding the conversation to include how hormonal shifts affect both men and women across lifespans. And this hormone conversation we've been missing, one rooted in education, empowerment, and understanding the body's wisdom rather than silencing its signals, and even more. So, are you ready for a great show? If you are on any of the different platforms, make sure that you like and share and also subscribe. Now, if you have a question, we do have some of our team watching the chats while the show is going and even after the show. So you can write your chat questions in and comments. And if you have questions that we don't get to, questions at dailywithdoc.com. And we will get answers to you. So folks, please help me welcome to the screen my friend, person that I just absolutely adore and appreciate, Dr. Laura Dennison. Hello, Dr. Laura. Welcome back to Daily with Doc and Becca, and thanks for being today's doc.
Well, thank you for inviting me. I tell you what, you have the best show. And it's just so exciting to see what information you're making sure people have so they can be equipped, for, longevity, for their health, for everything. And of course, this topic, it happens to be my favorite, and you know that.
Yes, yes, I do. And you know it. The reason why I do this is because I was one of those people that would try this for that, kept getting pushed from one specialist to another. And this pharmaceutical for this pharmaceutical for that, and this one for the side effects of that. And it was no fun. And even doing the supplementation, Dr. Laura, I wasn't feeling any difference until I really started taking what I now know and appreciate every single day, the 90 essential nutrients that Dr. Joel Wallach has researched and put together, and even the formulas to make it easy. Now, you are the creator and formulator for the Stay Natural line within the Longevity product line, which has some amazing products that go into the hormone and even more. I mean, I was just looking a minute ago, it's like, where's my bottle of Stay Energized? Because I absolutely love the herbal products as a community herbalist myself. So let's go ahead and jump into the topic of today, Dr. Laura. And I'm just going to turn it over to you. And as we have questions, I do see we've got hands up already, but I want you to get started on today's conversation, and then we'll go to the questions.
Perfect. And why, I was like you, Becca. I was, close to 30 years ago, I've always had hormonal problems. I was in high school, had very heavy, and we're just going to be open here, you guys. So you're going to be hearing some things that might embarrass you a little bit, but you guys, it's dependent on hormones. And so, but my menstrual cycles would go for months, and I became anemic. Um, and I just got shifted from doctor to doctor. They would put me on birth control pills, which was very embarrassing as a teenager. Then they would take me off, and they just couldn't get my balance, okay, of hormones. And this went on for years. And then I had children, and then all of a sudden I had these huge fibrous tumors on my ovaries. One was the size of a softball, the other one was the size of a baseball. And so, not knowing about the natural world at that time, I got a complete hysterectomy at age 27. Okay, talk about a horrible experience, because at 27 I have these two young kids, and I'm thrown into a cycle of hormonal mess. Not only my wonderful husband that put up with it, because one day I'd be crying, the next day I'd be wanting to strangle him, and same thing with the kids. They didn't know if if they should hug me or if they should stay away. And so it just was a very horrible experience for me. And so when we got into the natural health industry, that was one of my main focuses. We got in because my husband got sick, and so we, with Barrett's esophagus, and so we trended, away from mainstream medicine into the natural medicine, the medicinals of especially herbals. And that's how Stay Natural was born. And we came out with a product that was for men, okay? Because it came around the time of the Viagra, okay, the blue pill. And so we called it Nutravagra, okay, our product. And men were buying it, but then all of a sudden women came in and they go, "Oh, I got to get this Nutravagra for me." And I'm like, "Oh, okay, so it's working for you too." And she goes, "Oh, my hot flashes are gone, my night sweats are gone, and boy, it sure is helping in the bedroom." And so we had this product called Nutravagra. Now we got women on it, so it's a product for men and women. And I'm going to explain the reason why. But all of a sudden Pfizer sends us this letter saying that it's too close to Viagra, so we had to change the name, and we changed it to MVP, Most Valuable Player, which that didn't last very long because it was really a stupid name, to be honest. Because MVP, people didn't really understand. So anyway, now it's called Stay Balanced, and this is a product that Youngevity has, and what it has is it has testosterone boosters, okay, and so that was something that was needed in my body, okay, at a very young age, and most of the time, especially in women, testosterone starts to tank about in your 30s, okay, and I'm going to talk about estrogen. I'm going to talk about progesterone and perimenopause, menopause, and and this happens to men and women, and there is different symptoms of deficiency. And thank goodness for Dr. Wallach, because a lot of the nutrients that when you're deficient in zinc, okay, that plays a big role in your hormones. Potassium to magnesium. Magnesium, this mineral is the king mineral for hormone health. And so the 9 essential nutrients is essential that we take, okay? And then we get to lean on these different herbs. And we just had a release last year of this amazing system, okay, for women, okay? Sorry, men, but I have a product for you, okay? But it's for men and women, okay? And that's natural testosterone. But so what's exciting is you should always the symptoms of, like, let's just go into testosterone, okay? For women, it's always libido, and around 35, if you're older on here and you've had children, and maybe you haven't had children, but it's about 35 that in the bedroom you're like, oh, I'm so tired, oh, I got a headache, you're making up all these excuses because you don't feel like you want to have sex, okay, just plain and simple. Well, that's because the testosterone is tanking in the body, okay? You're losing it, okay? And by the time we hit menopause and perimenopause, it's a really sad deal, because now you're losing your estrogen at rapid rates. Progesterone, you lose it first whenever you go into perimenopause. And so these 3 key hormones, which we have hundreds of hormones in the body, but we're only going to talk about these 3 today. But when it starts, tanking, okay, when I say tanking, when your body starts losing it, your body's not manufacturing it, then you start having these different symptoms, okay? So for women, okay, on besides the low libido, testosterone could be muscle mass and strength. So we start losing our muscle. That's about when we start getting wrinkles. We think about that, because collagen and testosterone, they like each other. And so the muscle mass starts to weaken, your bone density. Estrogen also is dependent on your bones are dependent on estrogen and testosterone. 2 key, okay? You can't do one or the other. And for some reason, when we go through perimenopause or go through menopause, physicians are just putting you on a synthetic estrogen, okay? They're not putting you on, a roundabout, hormonal balance, okay, for your body. And so that's where you start losing that bone mass, okay? Osteoarthritis becomes prevalent in, older women, especially because they're losing the estrogen that was dominant in the body, okay? But then when you go through menopause, you lose that estrogen and also testosterone, and that's the one that they don't talk about. And so it's I'm a big fan of testosterone, okay? As you can tell, I've been taking a product that has testosterone boosting ingredients, and guess what? My voice is not deep, okay? And I don't have hair, or being buff, you guys, you can't supplement with enough testosterone to do that, okay? So that's just a myth. But cognitive function, brain fog, that all happens about, at perimenopause. And so it's necessary that you can't just supplement with one boosting product, okay? It needs to be balanced, and we have it here. And, I'm just so excited because, we're partnered with a company with Youngevity, and they are just on the cutting edge of supplements that just are really tailored to men and women. And women especially, they just came out with a system, but we can help with both of those areas. Same thing with men, okay? Low testosterone in men, and they lose it to 1 to 2%. Okay, women lose it. We don't need as much women, but men are dependent on testosterone, but they lose it at a not as a rapid rate. So 1 to 2% a year after the age of 30 is what you're losing in testosterone. Okay, so about 35, 40. Maybe you're not working out in the gym, but you start to notice that your muscles are a little bit not as strong. Okay, and so your mobility, especially when you hit 50s, 60s, and you're going through the change yourself, because you do, but you're losing testosterone 1 to 2% per year after the age of 30. Okay, women lose it faster than men, but we don't require as much as men do. So symptoms of testosterone deficiency: erectile dysfunction, decreased libido, reduced muscle mass, fat gain. Okay, and it's mainly in the midsection. Okay, that men and women will see an increased weight gain in those areas. But here's the thing emotionally that men go through. They get complacent. They get non-vitality. They're burnt out. That's why you see a lot of men, when they go through the change, will go buy a sports car, or they'll go do something erratic that they would never do. Okay, it's because their body needs more testosterone. Okay, their body is going through that change. Okay, that menopause. We're going to call it menopause for men too. Which, you guys, here's the sad thing about what we have thought all these years, that this was something that you go through and you just got to grin and bear it, and there's nothing that you can do. You're going to get through it, and then who cares about what happens in the bedroom after you reach a certain age? That is wrong. You should feel good. You should have good memory. You should have good muscles, strength, all the way until the day that we die. Okay, and it is dependent on hormones. Okay, and so, but depression is a big, especially for men. And I had a gentleman that he was on prescription testosterone, and he had came into, at that time we had a clinic, a storefront, um, and he goes, I've tried everything, and he was only 35 years old, around that age. And he goes, I just am so depressed, and I know it's low testosterone. The doctors diagnosed me with it, and I'm using this cream, and it's just not doing the thing for me. So we got him on the Stay Balanced. Within a week, he came back in. He goes, I will never be without this product, because it helped his body boost the body, because it has testosterone boosters. Okay, there's no testosterone, synthetic testosterone in the product. It wants your body to make it. Okay, and that's what you're going to see with these products that we're going to be talking about, is it allows your body to make and balance. Okay, and and so he got his life back, because he thought that he was just going to be in depression forever. He couldn't get out of that funk. So if you know somebody that is getting older, okay, and they're sort of non-complacent, they just don't really care about getting up, or different things like that, that could be because of their hormones. Okay, and so balancing out the hormones is the key. There's so many different symptoms that goes into hormone imbalance. Okay, so and mood and vitality, and just feeling good. I mean, having those being able to wake up and just feel like you could conquer the day. A lot of that is dependent on hormones and being deficient in your body not making the required hormones as needed. Okay, but bone density, so hormonal decline, the brain, the metabolism, cardiac, you also have cardiovascular risk. A lot of people don't realize that that as they get older, okay, and they are having to be on blood pressure medicine, or having to have a heart surgery, they need to get their hormones tested. I mean, that would be something that they need to look at, because it also is reliant on the necessary hormones. Okay, from estrogen balance to progesterone for women, and testosterone balance for men and women. Okay. And so that's very important. You know, another thing that for men, especially when you don't have that balance of, because men have estrogen, okay, in their body. They don't make as much, okay, so it's sort of the opposite of women, okay, we don't make as much testosterone, don't require as much, we still require it. And men need estrogen, or they have estrogen, okay, it's so needed for the brain, especially, but they don't require as much. But what happens when you have that imbalance, because testosterone and estrogen are best friends, you guys, they depend on each other to balance in the body, okay? And so if you don't have that balance, then men can also have, you know, elevated estrogen, okay, which really is scary because then you have, um, uh, you know, an imbalance, but also a cancer risk, especially with prostate cancer. You know, elevated estrogen, that's the reason why they use hormones, chemical hormones, to decrease that in the body for men. So looking back, if you were to get on a natural product that was keeping that balanced, isn't that a beautiful thing, instead of waiting until your hormones are out of balance? And so everybody that's on here, and especially if you have, like I was, okay, I was a teenager, I was going through horrible, you know, menstrual cycles. That's not normal, okay? That's a hormone imbalance. If I would have been given a natural product that at that time, and the 90 essential nutrients, all these things that I needed, and stay away from things that in the environment that causes it. You guys, here's a word for you to look up, and I am going to be going over this on my professional Facebook page next week. But endocrine disruptors, you guys, that's in our makeup, that's in uh, cleaning supplies, that's in your shampoos, your lotions, non-stick frying pans. You know, these have, you know, phthalates and PFAs and BPAs and all these chemicals that the United States allows into our country, you guys, causes a hormonal disrupting in your body. Okay. I wish I would have known that, you know, back then. We didn't. And in fact, back then, because you guys, I'm 55, and back then, AJ's laughing at me because I'm old, but I feel great though. Okay. But back then, you guys, that's whenever like fast food started coming around real hot and heavy. That's when also uh, scented things, okay, like scented candles, you know, the overuse of soy, you guys, soy is, you know, back, I can remember, you know, all the packaged bars and all the things that has soy lecithin in it, okay? And soy was something that we were supposed to drink, like soy milk and all these different things, because it was supposedly healthy for us, for our hormones. You guys, that's harmful for your hormones. It makes your body, it's a phytoestrogen. And so it makes your body mimic estrogen. So then your body quits making estrogen. Okay. So endocrine disruptors can cause so many different things. So I got very passionate about this, and I'm so thankful that Youngevity also has a natural makeup line, because I have grandkids, I have granddaughters that, you know, 6 beautiful granddaughters. And I think about the big Sephoras and the big Ultas, you know, that's popular right now, and all these harmful ingredients that these kids are putting on, or they're shampooing their hair and different things. You have to be aware that that can also cause a disruption in hormones. Okay. So what do we do? Well, one, okay, you need to get on the 90 essential nutrients, because like I said, it's dependent. I mean, uh, I can take my mineral stick. If I ever skip my minerals, which is not very often, okay, I can just sort of feel a little bit blue, or just not that pep in my step. Well, it's doing more for my hormones, okay, balancing that out, especially magnesium, zinc. You know, if you're fighting depression, okay, we have specific zinc products. We have an immune support product that has, I think it's even called Zinc FX, that you may need additional zinc. Okay, zinc is very necessary, especially whenever it comes to, you know, hormone health. But the 90 essential nutrients has it all in there, and so we're dependent on these minerals, especially. calcium, magnesium, you know, the plant-derived minerals. These are all necessary for hormone health. Then we have boosting products, okay? We have this system, okay? And I'm just gonna go over each product real quick. And they just came out with this, and it's beautiful. Okay, for everybody that knows me, I get really giddy or really when I see products that have the right things in it, the right tools, the right connection to do its job. Okay, because you guys, there are some products on the market um, that you see an ingredient on there and you think, oh, that's going to be amazing, but then you start looking at the milligrams, and you guys, it's just like fairy dust. You know, they're just putting it on the label, but it's not going to do anything for you. So I get excited when I see products, especially coming from longevity, that are manufactured in a way that is going to give you the best health. Okay, and these products all can be taken together. It can even be taken with a stay balanced. They're all four of these do something different. Okay, and I'm they have this system, and then I'm putting my stay balanced in there. So because you guys, it has a natural testosterone. None of these overlap ingredients. Okay, so the first is rejuvenate, rewind, and restore. This is an amazing product. You know, because when you talk about hormones, you also talk about aging. Okay, and we talk about longevity. You know, we want to live as long as we can, as healthy as we can, and we want to be, you know, feeling good. Okay, we want our older years to be just like our younger years. I mean, and that can happen. I mean, you know, I look at I'm going several people that, especially in longevity, in like Peggy Labs, there's so many people that just look amazing and they feel good and they're vacationing and they're doing all the things. Okay, it's because they've been taking supplements and you know, and trying to eat healthy and trying to stay mobile. Okay, you can do that. If you're on this call and you've been struggling with your health, you're in the right place. You guys, everybody on here, all these health coaches, they're designed to help you to get over whatever struggle that you have in your health. Okay, and we do this together. Okay, back to why I get excited about these products. Okay, this is rejuvenate, rewind, and restore. It actually helps at the cellular level, and it opens up those cellular pathways. Okay, so it really helps to fight free radicals, get, you know, stuff that's in your blood, in your system that shouldn't be there. And so it helps to calm the body down. It helps with elevated cortisol levels. It helps with blood sugar support, you know, which also helps, you know, reduce the weight. And so it's just a really good product. And it's designed, you know, for that antioxidant support. Okay, and it helps open up those cellular pathways. And so it's really doing a lot of things in the blood. It's got niacin, riboflavin, copper. It's got a thessalin. Okay, and that was a new ingredient for me, and I looked it up, and it's absolutely incredible. I mean, it's an amazing ingredient to help support healthy blood. Okay, and so I really like that. Quercetin, D-ribose, CoQ10, and then it's got bioperine, which is a form of black pepper. And so that helps with circulation. So it's helping to get things moving, okay? And even with the lymphatic system, this product is really good for that, okay? So that's one part of the system. The second part is the menopausal support, okay? And these are designed for women, okay? Um, and so this has ingredients, and one of the most fantastic ingredients that it has is what's called ashwagandha. Okay, that is an amazing ingredient, and it's good for, you know, cellular health. It's good for stress. It's good for elevated cortisol, but it's going to help your body to make the necessary hormones. Okay, there is not any hormone activating ingredients in it. What it does is it helps the body boost your body to make the necessary hormones, make the estrogen, make the progesterone. But when you are taking ingredients that does not have, like say, black cohosh, okay, or evening primrose, okay, those are two known estrogen herbal medicinals, okay? When you're taking ones that activates it, okay, your body's going to make what it necessarily needs, okay? It's not going to make an abundance, and it's not going to do your highs and lows. It's going to be a daily fill of being able to make necessary hormones, okay? So you're getting that from this product. So say you're perimenopause or you're menopausal, this is the one that's going to help with the hot flashes, the night sweats, all the symptoms, hair loss, nails cracking, wrinkles. These are all things that are dependent on hormones, brain fog, you guys, and hormones depend on cholesterol. Okay, so if you're also on here and you're on a cholesterol lowering medication, we really need to talk about that, because when you're lowering your cholesterol, guess what? You're making those hormones. Okay, so now you have a hormone imbalance because you're on a cholesterol lowering medication. Okay, which I never tell people to get off their medications but cholesterol lowering medication is one of those that you need to really consider to get off of. But this also has the mineral support. It has potassium, calcium, magnesium, selenium, chromium, vitamin B6, folate. Okay, and I love that it has folate because women are dependent on that nutrient. And so, but then it comes into the herbals, and it's got the rhodiola. Okay, you guys, rhodiola is not only helps to support and make necessary hormones, but it also works as an adaptogen. An adaptogen works to adapt to your body. Okay, and so I love that about rhodiola. It's got chastetree berry. Chastetree berry is one of the biggest ingredients that goes into this to regulate hormones, and because it's just a fantastic medicinal for hormones. Then it's got the ashwagandha, like I said, alpha lipoic acid, cinnamon bark, and then it has a registered trademark rhubarb root, which I love that ingredient because it's also in my Hope product by itself. It's in a blood cleanser, but it does so many different things, and it really supports healthy hormones. And so this is the Cadillac, okay, whenever it comes to hormone support, okay, but it's in a system, okay, because you need it from different areas. And then the last of the system is the probiotics. Okay, I'm in love with this product. I can't wait till they sell it also out of the bundle, because you guys, it has 16 different strains of probiotics. So let's talk about probiotics. Normal probiotics has 3 to 5, okay, 3 to 5 strains, okay. Every strain of probiotic is designed to go to a certain area of the body, okay. So if you only have 3, then you're missing out on other probiotics that actually could go to other areas of the body. Women especially have they're more susceptible to urinary tract infections. They're susceptible to vaginal dryness, and so probiotics are one of the things. It's the good bugs versus the bad. I mean, that's how you need to think about a probiotic. Everybody needs to be on a probiotic. And we do have a probiotic out of the system that has 14 different strains, which is Nightly Essence, okay? But this one has 16, and I am super excited because it's going to go to all areas of the body that needs healthy, good probiotics, okay? And so, like I said, you need to have more good bugs versus the bad bugs in the body. And so infections, I mean, probiotics restores a healthy gut. The gut makes a lot of the hormones, especially at night. And so this is a very important product. It helps with digestive, and that gut brain connection also so it's going to help you with the memory fog and different things that goes into hormones. Then the last product that I'm in love with is a product called Stay Balanced. This is for men and women, okay? And this is the one that we developed over the course of, well, it would have been, I was age 27, okay? And so we developed this 25 years ago. And this is the one that, I mean, if I was on a plane and I forgot it, I will be shipping it to my destination, because I'm dependent on this product, because it balances my hormones. You guys, some physicians and I'm not disagreeing, but they say, just go through it. Your body will adjust. Okay. Your body's never going to adjust to trying to make hormones. Okay. My body couldn't adjust. And I went through at least 2 years of misery. Okay. And they put me on estrogen. They put me on ester test. They put me on the patch. They put me on antidepressants because I would come into the doctor and I'd be crying. You guys, this is whenever I had my hysterectomy, age 27, and was thrown into full blown menopause, which the root word menopause, I think the Greek or Latin, it means crazy. You guys, that's terrible. Okay. Why are we labeled menopause? I mean, nobody wants to go through menopause. Nobody wants to go through crazy, right? We don't have to. You guys, if I would have had this in those 2 years, oh my gosh, it would have been a beautiful thing for me. But I got it after. And so I had the hot flashes, the night sweats. And this product has testosterone boosters. Okay. And I told you, the importance of that hormone for women just as well as for men. Okay. And so this is a man and woman product. It also has selenium, zinc, like I was talking about, manganese, potassium. It has fenugreek. Fenugreek is another really good hormone balancer. It has macaroot, which macaroot helps to balance out all hormones in the body. So it's not overlapping ingredients that's in the Hope Bundle. It's something that you could just add to what you're already doing. Now, I did want to show you, if you are into researching and different things, and you want to learn more about testosterone, especially for women, this book is called The Secret Female Hormone. Okay. And you guys, testosterone, when you go in and you see your lady doctor or your regular physician, they hardly ever test for testosterone. Hardly ever. And you guys, it is so necessary. It's The Secret Female Hormone, How Testosterone Replacement Can Change Your Life. And it's by Kathy C. Maupin, Maupin. This will help you understand that balancing act. Okay. And you can take it forever. You guys, you could take all these products forever. People say, well, if after I go through menopause, do I get off the products? Why? If you feel so good, why would you get off the products? I mean, you are actually will cause your body to quit making them, then you'll have less libido. And I'm telling you guys, I mean, you should want to be with your partner till the day you die. Okay. And so if that's not happening and you're having the low libido, we need to fix your hormones because it is something, it's nature. God intended us to do that. Okay. And so, it's very important that you look into that. So Stay Balanced is a beautiful product and it's very affordable too. And I think Becca, she has some testimonies on all of these products probably of how well they're doing for people and amazing things are happening.
Yes, and I mean, we have lots of hands, Dr. Laura. So AJ's like, get on the screen. We have so many hands. So I don't know if you have a hard stop or not, but we have 6 hands up right now. So are you ready for questions?
Absolutely, you bet.
Fantastic. And just a reminder, everybody, if somebody referred you to this show, get back with them with your questions. And especially if you are ready to get your hormones balanced and working the way that God intended them to. So get back with the person that shared this program with you. If there's no one to thank, you are feel free to give us a call at 855-949-3377. If you've never tried any of the products, we do have a store also on dailywithdoc.com, which is the sponsor of this program. So first, Verna, go ahead and unmute yourself. What question do you have for Dr. Laura today?
Good afternoon, everyone. I have a question about the Stay Balanced. I have been diagnosed with hormonal imbalance. I don't really have hot flashes or anything like that. Sometimes I may have a little issues sleeping on occasion. I'm wondering about, oh, and the other thing that I'm really not happy about is my hair. It's really thinning, and I do want to correct that situation. Um, oh, oh, and I do a lot of exercise and things like that, but I do notice that my muscle mass is not as great as it used to be. So will the Stay Balanced, the one you just talked about, help with these issues?
Okay, and so you have, a few of the hormone imbalances. Okay, the Stay Balanced, and you don't have to have hot flashes to need to balance out your hormones. Hot flashes will, come and go, and sometimes, during stress is whenever they could be worse if you're in an imbalance of hormones. But yeah, the Stay Balanced is a beautiful product. And everybody is unique, okay, to their own body in hormones, okay. And so I always tell people to try the Stay Balanced, okay. Some people need more than 2 a day. When I was having severe hot flashes, I had to do 6 a day, which normal dose is 2, 1 in the morning and 1 at night, okay. But I had to go up to 6. Well, now that we have the Hope bundle, you guys, you take this with the Stay Balanced. And take the normal dose. I would take the normal dose, see how you feel. I mean, you can always increase if you need to, but these are designed for a lot of those symptoms that you just mentioned. Now, Verna, make sure that you're also on the 9 essential nutrients, okay?
Yes, yeah.
And I like the new ZRadical product that has the collagen, because
Oh,
collagen
yes, I just tried that yesterday. I had a sample.
beautiful. Well, collagen works hand in hand with testosterone, like I was talking about. And so, and we start losing collagen at the same time, about age 35. Okay, that's when our muscles and the wrinkles and all the different things. And so, adding a collagen product, and I just threw out this new ZRadical one, but we have several to choose from. That would also be very beneficial.
Okay, all right. Thank you very much. Appreciate it.
You bet.
Awesome, awesome. Thank you, Verna. Good to hear your voice again. And next, let's go over to Carrie. Carrie, go ahead and unmute yourself.
Hi there. I have a client who is on the phone listening, who's a man who tried the Stay Balanced, and today was his first time of using it. He's been on the Longevity Products, the Healthy Brain and Heart Pack, for over 6 months. He's doing really well, and he cleaned up his diet before he even got to us, and he's been in the medical system, right? So he's had stints, and he's had a cardiologist, and he's been on the blood pressure medications, and of course they made him feel terrible. So we're trying to make him not feel terrible, and things were improving, and we just decided to add some hormonal balance to it, but it caused a flush and sweating and jitteries, as he put it. And he's on the call listening, and I would just I really appreciate Dr. Laura and her expertise, and you guys' expertise with the combination of longevity products and herbal products. And maybe you could talk a little bit about the potency, the speed in which they act, and how long they last.
Absolutely.
And what it takes for the body to get used to it, or maybe this is not right for him right now. I would, maybe you could share your expertise in that area as well. And maybe if he wants to, he can talk as well.
Absolutely. And so, so what he was describing was a niacin flush. Okay, when your body gets too much niacin, which we do have niacin in the Stay Balanced, plus in the 9 essential nutrients, and probably in the Brain and Heart Pack, there's probably extra niacin in one of those products. And so, what I would suggest is he just takes it at opposite times. So if he does the 90 essential nutrients in the morning, he drinks that first, okay? Then wait until the afternoon, maybe after lunch, to do the Stay Balanced. And then he could even do one before he goes to bed. That can be taken before he goes to bed as well. So the flushing can happen. It doesn't necessarily happen to everyone, but if your body, which, you know, having the cardiovascular issues that he has, his body has been missing niacin. I mean, that is one nutrient that that he has been, you know, starving from. Okay, now that he's getting, you know, more, and he's cleaned up his diet, which is wonderful. You know, he's on the right track, and so I wouldn't not take the Stay Balanced. I just would take it not with the 90 essential nutrients. I would take it at opposite times, and he might take it like the first week with food. Okay, so then he's not getting it on an empty stomach and that jittery feeling. Okay, you shouldn't be getting that unless you're getting like a nice and flush. And so what I would hope for him is to also make sure he's monitoring his blood pressure. Okay, because hormone imbalance, one of the side effects to blood pressure medication is low libido. Okay, so it lowers the testosterone. And so I would, you know, with his doctor's helps, you know, I would monitor his blood pressure. He needs to be doing that every day. You know, some clients that I know don't even know what their blood pressure is, but they're taking blood pressure medication. So just make sure that that's happening, and keep doing what he's doing. I mean, it sounds like he's on the right track.
Excellent. Thank you so much for that. Thank you, Carrie, for bringing your client on the call and addressing their questions so they can hear it from the doctor. Now, just a quick comment. Nancy says today's subject is so right on for where thoughts have been lately. I like Dr. Laura. I wish I had this information much earlier in my learning journey, as I am now 88 plus and doing well. Except this area hasn't had the attention it could have had in my support. Awesome. Wondering how now, what I can still experience at 88 plus.
Well, Nancy, do not give up. Okay, you need to get on the hormonal products. It's never too late. And a lot of people, they might just feel like, you know, they have an extra pep in their step. They might notice that they're thinking better. Like you guys, our brain is dependent on hormones. Okay, and so it's never too late to try the Hope Bundle and the Stay Balanced. It's never too late. And
Awesome.
yeah, and things can happen. I mean, you're just going to feel good.
Fabulous. Thank you so much. Let's go over to Phyllis. Phyllis, what question are you bringing in today?
Hello, Dr. Laura. This is such important information. Thank you. I have two questions. One is from Olga on YouTube, and she wants to know your opinion of topical USP progesterone cream for hormone balancing.
Okay, so I'm not a fan of progesterone cream, and here is the reason. Progesterone is it is a hormone that is once it's in your body gets rid of it pretty quick. Okay, so you got to do it every single day. People that are on the progesterone cream, their body will assimilate it in different ways. Okay, so they may get an abundance one day because their body didn't get rid of the necessary progesterone that it needed to use up. And so people will sort of do the teeter-totter, okay, with the progesterone cream. Like some days they may feel really good, other days they're like, oh my gosh, I'm just a mess. And it's usually emotionally that it causes more issues with, as well as weight gain. Too much progesterone, and they're putting a lot of teenagers, young adults in their 20s on the progesterone cream, okay, to help with stress. But then what's happening is they're having, you know, extra weight gain. Progesterone is a hormone that's needed when you're pregnant and needing the extra fat, and is helpful for you know, stimulating and helping the baby and you through pregnancy. So when you start supplementing a synthetic kind, I'm not a fan of that. The in the Hope Bundle, this women's excuse me, the Life Balance, okay, it has natural progesterone boosters. Okay, so it's going to help you to balance that out. I would probably get away from the synthetic and just try it, because you can always go back. I mean, if this system doesn't work for you, you can always go back to the progesterone cream.
So better to have our bodies produce the precursors to the progesterone, and then we'll automatically get the right amount instead of having to play with this artificial cream.
Absolutely. And the thing is your things that happen daily for you, like say you're somebody was in a car wreck, or any stressful condition can cause your hormones to be out of balance. Okay, when you're feeding it daily with the right ones to make it, then it's going to make enough for progesterone, testosterone, estrogen that your body needs, especially during those times.
All right. And then I have a question for one of my male clients. You had mentioned your husband had an issue with Barrett's esophagus, and that is what my client is dealing with. And right now he's taking the plant-derived minerals, enzymes, sweeties, and probiotics, but he has chosen to take another multi from another company. Could you, number one, talk about what regimen he should follow? And number two, what will make a difference for him in taking our multi from True Longevity?
Okay, and so we have a lot of great products to pull from with Barrett's esophagus. Okay, Barrett's esophagus is a scarring, and it's usually caused from acid reflux, and it goes from acute to chronic, and when it gets into the chronic state is where the scarring can happen. Okay, and that's where it's called Barrett's esophagus, which is more or less cancer of the throat. Okay, when my husband went through that, we had just came out with a product called Eat Less. Okay, and so he changed his eating habits. He didn't eat after 6 o'clock. He did more of the intermittent fasting. So that's very important for your client to make sure that he's not eating too late. Okay, he's on the enzymes, he's on the nutrition. When you're in, not saying one versus the other, but it is easier to take, not easier, it's so you're not duplicating vitamins and minerals that you might not need to, because you can get too much of certain vitamins like vitamin A, just one of those. So I probably wouldn't duplicate two systems. I would stick with the 9 essential nutrients and the enzymes and the probiotics. Now, one good because with Barrett's esophagus, there's two things you need to do. You need to settle the acid. Okay, make sure that that he is salting his food. Okay, that also helps to settle the acid. But he also needs to make, and the probiotics is helping with that. The enzymes are helping with that. But he also has to get the food moving through the body. Okay, so people that have Barrett's esophagus normally have chronic constipation, and so that's where the Eat Less comes in, because it helps to keep the food going the other direction. Okay, and so it helps with bowel movements. That's another question I would also ask if what his motility and that. And then another product which I'm a big fan of, in pharmacist Ben, is the Fucoid Z. Okay, that also helps with digestion, but it also helps to keep the food moving. People that have leaky gut, any bowel issues, because when we think about the esophagus, they're only treating this part, but we have to make sure things are getting moved through. And so it's more than just how you eat and different things. You have to make sure that you got the proper elimination. So the Eat Less in the Fucoid Z comes in for that.
And doesn't the Fucoid encourage normal cell activity?
Yes, and the Fucoid, I mean, it's a at the cellular level, I mean, it really is like, it's not a super antioxidant. It does more than that, and so it's just really helpful for the rebuilding of the cells. And so that's the reason why I always make sure that people get on either the Fucoid Z, which is the person doesn't want the calories and different things, or the ZRadical.
Great. Thanks, Dr. Dennison.
All right. Thank you, Phyllis. Now, Dr. Dennison, I have a follow-up to Carrie's question. She would like to know if you could discuss the potency of herbs and minerals supporting the body versus the body forcing the body like pharmaceuticals do?
Okay, so people, when they look at medicinal herbs, they think, oh my gosh, I'm going to take this and my headache's going to go away. Okay. The potency is when you take it, is going to take a little bit longer to work in the body. Okay. Whenever you're talking about medicinal herbs. Okay. That's why a lot of people will reach out and take an ibuprofen because they want the immediate relief. Pharmaceuticals are very strong. Okay, they're putting a band-aid, okay, on the condition, but they're never doing anything to help repair the body. Nutrients, especially our 9 essential nutrients that are, you know, every deficiency, caused a man, okay, that causes these conditions. That these 9 essential nutrients can go in and help to repair. So medicinal herbs and works like medicine, but it does take a little bit longer. Like, so for, say you had knee pain, our Stay Restored is one of the top medicinal herbs on the market, okay, to help with pain and to help to restore. But it's not going to happen overnight. I mean, you might take it for 3 days, and all of a sudden you're like, oh my goodness, my knee didn't hurt getting up today. And so it takes a little bit longer, but you're not having the side effects. It's not putting a band-aid on it. It's actually going in and trying to regenerate and repair. And that's what you get from medicinal herbs and vitamins and minerals versus a pharmaceutical drug. So if you're on a pharmaceutical drug today and you're listening, there is ways to help the body to where your body doesn't require that medication. Medications was never designed to be taken for life. Blood pressure especially. Blood pressure medicine was not designed to be taken for life. But if you're still eating the ho-hos and the fried chicken and all the things that causes inflammation, then you know what? Maybe you're going to have to take that medication because you're not willing to clean up the diet. Get rid of the gluten, get rid of the things that's causing the damage. And some people, especially diabetics, because it's food related, you guys, I mean, it really is. And but some functional medical doctors still have to give the insulin because the client still doesn't want to clean up their diet. Okay, that causes the diabetes. I hope that answered.
Isn't it crazy how we get in our own way?
Well, and it's sad. There's not an easy button out there, you guys. It does take work, but when you can feel so good on something natural versus taking a medication for life, it's beautiful. Knock on wood. I mean, I never have to be on a medication. I mean, I don't think I'll knock on wood. Anyway, that's one of my goals is to never take a medication.
Oh, fantastic. Mine too. Never again. So we have several more questions. So when is the best time to take the Hope products and the Stay Balanced? That's one question. The next question, is it okay to take the Hope Bundle, Xerafem, and Stay Balanced? Okay,
so Xerafem is a beautiful product, but it has a lot of ingredients that's going to be in your Rejuvenate and Unwind and Life Balance. Okay, so I don't know but if you want to continue to take it, it's not going to hurt anything. Okay, Xerafem is more coming at the vitamins and minerals, and that's what you're also getting out of the Hope Bundle. Okay, and so but with the Stay Balanced, you're not overlapping ingredients because I never want anybody to waste money. Okay, and I think that with this you can. Some people may just want to stay on the Xerafem, okay, and not do the Hope Bundle because you're having good results. Okay, so we do have a lot of products to lean on. Now, as far as taking the products, okay, it says on the instructions on it, okay, but making sure that you get it in, okay, because a lot of people will say, oh, you told me to take one this morning and one at night, and then I forgot to take one this morning. Then take 2 at night. Just make sure you're getting the full dose of the product, of the normal dose. Okay, so the Life Balance, you're supposed to take 1 twice a day. It would be better if you took morning and night. Okay, because then you're spreading it out. But like I said, if you forget, take it 2 at one time. Okay, if that has to work for you. The Rejuvenate, you want to take it because it's going to help the body at the cellular level, so it could give you some energy. So I would take it morning and afternoon. Okay, I probably wouldn't take it at night because it's doing more of an antioxidant ability, and so you possibly could it could keep you up. Okay, it's going to rev you up a little bit, not rev you up, but it's just going to make you feel good. The probiotics, there's two ways to take it. You could take it first thing in the morning on an empty stomach. I personally like for people to take it at night because you're getting the most repair of the gut at night. So if you're doing the intermittent fasting, like you're stop eating, 6, 7, 8 o'clock, okay, and you're going to bed at 10, then that's 2 hours of the body not digesting food, okay? Then you take your probiotic, guess what? It's going right in there. It's not having to worry about messing up with some food or anything like that. Now you get the same experience in the morning, but then you're going to eat breakfast, 2 hours later. Okay. I personally, my opinion, which it is just my opinion, but I would take it at night.
Okay, thank you so much for that. And let's
And to
go.
stay balanced, you just take one in the morning, one at night, especially if you have hot
Fantastic.
flashes. Okay.
Awesome.
Okay.
Let's go over to AJ, the next hand up. AJ.
All right, Dr. Laura. A couple of comments before I ask my question. Number one, I don't think they sell ho-hos anymore. I think they got the message. I don't think those are on the market. My second comment is all women cover your ears. Men, stay balanced. Do yourself a favor. Take it from AJ. Anyway, and then so my question is for a distributor named Patrick. He's got a client named Ross who's 43 years old, 5'11", 223 pounds, diagnosed with autoimmune disease, thyroid problems. Ben would have stopped me already. He complains of stiffness, arthritis in his neck, back, shoulders. He's having skin problems where the pigment is being lost. He's been diagnosed with hyperthyroid, alkalizing spondylitis, and schizophrenia on antipsychotics, which has caused his cholesterol to be high. He's on lodazepine and Depakote. So he's dealing with some situations, and he's wondering what direction he should go. Maybe give him some baby steps or.
Okay, so the very first thing he needs to do is he needs to get on the 9 essential nutrients according to his body weight. Okay, and so whatever it's 1 scoop per 100 pounds, so he's going to need to take 2 sets of the 9 essential nutrients. Then I would also suggest that he gets on the ZRadical, okay, because a lot of those issues has to do with blood, okay, and also with him having the hyperthyroid. I wouldn't go straight into products that's going to be too strong for him to take, okay? And so the ZRadical comes in and it cleans up the thyroid, and so it helps with the autoimmune, because hyper means that his body's making too much of the thyroid hormone, and so we don't want to do like the Ocean's Gold or anything like that. We just want to do it with the ZRadical, okay? And I would probably double that dose for a month, okay? Then I would also get him on the Hope, not the Hope bundle, but the Hope blood purifier, okay? That would be the best system to start off immediately. And then I would also add the selenium. I would also make sure that he's getting the selenium. That would be the baby steps, but the very first thing he needs to do is he needs to get off any gluten. And the reason is now he's got skin problems and he's got all this inflammation. He needs to clean up his diet in a big way, but baby step number 1 would be gluten. He needs to go gluten-free, not a bit put in his body, okay? Because that a lot of his autoimmune conditions, a lot of the skin problems, even the pigment problems, it's all happening at the cellular level, but his body's full of inflammation. And so we got to get, all the joint pain and all that kind of stuff is going to go away. That's just the effects of the next step of all the problems that he's having. Okay. And so that's what I would get him started on. And that's when he starts feeling better, then we keep adding additional products to help with the additional systems that needs to be worked on, like whether it's cardiovascular, digestive, which a lot of it is. That's why that ZRadical is going to help in that way on the cellular function of that. But that is those would be my baby steps that I would do. 9 essential nutrients, double, ZRadical double, hope, and that's what I would address it with, but gluten-free. He's got to, all that pain's going to go away within 2 weeks of him getting gluten-free. I mean, period.
That, I think that's a very loving answer. We definitely need to get you back on the show ASAP. And I want you to maybe talk to us about super estrogens and those crazy words that we hear from time to time, but not today.
Absolutely. Thank you, AJ.
All right, Dr. Laura. Few more questions. Harry out on YouTube says he has a friend of his, female, in her 60s. She has had shingles for 7 months, has affected her optic nerve, and she has shooting pains in her head when she touches her forehead or eyes. She has been using some of the 90 for life. Any suggestions would be appreciated. Blessings, Dr. Laura.
Yes. Okay. So you guys, shingles is a virus that'll stay dormant in the body. Okay. She probably had chickenpox way back when, and that's the reason why they try to do vaccinations, but that's not the problem. It was her immune system. And so we got to fix her immune system. That's the reason why she's having the periods of the shingles. Okay. So 9 essential nutrients faithfully. Okay. That needs to be faithfully. Selenium, but then also the Stay Young out of the Stay Natural line really helps because it has the citrus bioflavonoids, which shingles hates vitamin C. Okay. And so when you do a medicinal herb like the Stay Young, and I would do probably double to triple in a month, because I mean, she's in a pretty sad case right now. So, I mean, she's in pain. She can't touch her, head. And so, but the Stay Young also crosses over the blood-brain barrier. Okay. So that's going to be another product that's going to help to get the nutrients up in that area. And on the 9 essential nutrients, I would probably go with the Rise and Restore. That's going to have more of the adaptogens than the BTT. And so that's going to also be something that is going to help more at the cellular level. But I would do that. I would do the Stay Young. Of course, the ZRadical is always my best friend, with that. And but I would start there. Selenium as well.
Okay, so I just want to clarify, we have the BTT, also known as Beyond Tangy Tangerine, original 2.0, 2.5, and now there is Rise and Restore 3.0. The next question would be, you still take the Osteo-fx?
Correct. Yes. The Rise and Restore, you guys, just replaces the BTT. It's the BTT 3.0, but they call it Rise and Restore.
Yes. Awesome. Thank you so much. Anne is saying that she especially loves the probiotic complete, that she has noticed a big difference in that Hope bundle. And let's go over to Keely with her hand up. And do you have a few more minutes?
Yes, I'm good.
I did see that you came on again, so I'm thinking that's your other half.
Yes, he must have came on. Yeah.
Hi, Dr. Laura. How are you, dear?
I'm doing great.
Can you address, I have a client that has edema and lymphedema, was taking a lot of the original products on Doc's protocol. Can you address the change in additives and or fillers in any of those products that are creating problems for them?
Okay, so with longevity, okay, they have very clean products. And so if you were taking a product that had on the older, like the Ultimate Daily Classic liquid, that may have had like sodium benzoate, it helps to stabilize the product. Okay. You're not getting that in the newer products. Okay. For sure. And so Youngevity has clean products. So as far as addressing any of the chemicals that would be causing, slowing down any of the protocol, as far as the edema and the lymphedema, it should not be doing that. Okay.
I know
So
specifically I've had 2 complaints on 3 different people. One of them was on the Rebound product and the changes that were made to that. And the other one actually was just on pollen burst, but it was on a particular flavor of the pollen burst. So I'm just questioning all that from your perspective.
okay, well, I don't like chemicals, and so I go with clean products. And so if they had to, what ingredient did they put in? What?
I couldn't tell you because I'm not looking at that information, but I could get it
Okay.
to you later if you'd like.
Okay. And the only reason why they would ever have to put it in there is if the stability of the product. And so I can't actually answer that question since I'm not looking at the Rebound or the other as far as it
Okay.
having a chemical in it.
Have you ever done a class on additives and or fillers in order to just educate us as distributors?
I haven't, but I would love to do it because I love talking about, just like when I was talking about endocrine disruptors. I mean, it's very important that we take a look at that because the added fillers, just like in our Stay Natural brand, we have it all in vegetable capsules. Well, Youngevity has also adopted going over to vegetable capsules, and so there's a lot of things and a lot of things that was way back when was not considered maybe a harmful chemical. I mean, but going forward, I mean, Steve and Michelle do a really good job of making sure that that there's not anything in it like oils, gluten, all the different things, but also chemicals. So yes, I would love to do that for you. Now, what was your other question as far as the lymphedema and the edema? Okay, so she would also benefit. Okay, so she needs to do the 9 essential nutrients. I would do the Rise and Restore 3.0 because it has more auric value to it. Okay, when you have edema, this is where your cell tissues are accumulating water, and then all of a sudden, you got several layers of the derma that that you have problems with. Okay, another 2 products that I would also make sure they eat less. The eat less helps to filter the kidneys, which also will help with getting rid of the fluid. Okay, the Stay Balanced helps with hormones, but it also helps with circulation, and so that's also going to help her with blood flow. And I think there was even a post on the official Facebook, somebody talking about the Stay Balanced and how it was helping to improve their blood flow, and
Okay.
and that really helps with that. But
So I heard you say eat
essential
less.
nutrients,
You said eat less, stay balanced. I know she tries the Rise and Restore and the swelling got worse, so she went back to the BTT.
Okay. The most important thing is we got to work with her body getting rid of the fluid, and so I would make sure that she's drinking extra water as well. Making sure she's getting, because a lot of times people won't drink enough water when they're collecting it, and so we're sort of like, I mean, a camel's going to store water if you're not putting water in. Okay, and so we need to make sure we're getting her. And another thing is she could also, if she feels like, well, and we have also the Good Herbs line that she could pull from and actually do a spray on her lower limbs, and it's called lymphatic support and antioxidant response. Those 2 would really be good to put with the plant-derived minerals and actually spray on her legs, on the outer part of her legs.
Fabulous. Thank you very much. Appreciate it. Look forward to that class you're going to teach in the future.
Okay, sounds good.
All right. Bye-bye.
Bye.
Sounds like a great topic for Daily with Doc. So we'll get that on the schedule for you folks. And folks, if you're watching us on any of the platforms, or you can check that description and you will see a list of all of the products that are being spoken about and mentioned today on the show. Let's go to Yasina. Go ahead and unmute yourself.
Thank you so much. Doctor, I have a question. I know I've been on here a few times, but my question is, I'm going through I'm postmenopausal. I have ringing in my ears. I have severe anxiety that I end up in the hospital for that, the emergency room. When I go in there, they do blood work, they check everything, my heart, everything is normal, everything is fine. But the only medication that I do take is 50 milligrams of the losartan. My blood sugar is good every morning. It's like 102, 97. My blood pressure is pretty much under control. I do take the medication daily, and it's usually 120, 118, 119. I eat clean. I have been taking the 90 essential, the healthy and heart and healthy pack for a couple months now. But the panic just creeps up of me out of nowhere. And I want to know, I hear that it's all related to menopause, anxiety, the ringing in the ears, the stress and so forth. So I wanted to know, you talked about different products. Which one should I be on taking? And
So
I
you're
am going to sign up with someone. I don't know who is going to guide. I want somebody that can guide me, not just give me products, but really teach me on the products, because it's not just myself. There's a big community where I live that need help. And I want to be able to teach them, not, there's a lot of products and I'm not familiar with mostly all of them, but I want to be able to learn and be able to help my community in guiding them what is good for them to take, So, but starting with myself, this is what I'm dealing with.
Okay, and Yasina, you are in the right place, and Becca and AJ and everybody that's on here, I mean, they're certified health coaches and they know about the products, and so you're in the right place. Okay, so let's go back, because there's a lot of things that, yes, it can be a part of the menopause, and because like I was talking about, especially on testosterone deficiency syndrome, there is an actual syndrome of it. Anxiety, autoimmune conditions, depression, agitation, all can be related of lack of testosterone, especially. Okay, and so with the 9 essential nutrients, and you're said that you're doing the healthy heart pack. That's good, because the essential fatty acids is also going to help with that anxiety. Okay, and so you can always take extra if you feel that coming on as well. You can take extra minerals if you feel that coming on. I would take the Stay Balanced, just 1 twice a day, trying to let that help to balance out the testosterone. The Health Bundle would also be very beneficial, but there's a product called De-Stress. And De-Stress is a great product that you can take daily, but you can also take it, especially when you feel like you're needing to, you're having a panic attack or the agitation. It's got it's designed for that, and it's really high in the vitamin Bs, especially B12, which B12 helps your body to calm down. And that's the nutrient that usually is lacking whenever you go through a stressful condition. Okay, you're eating clean. Another thing is to, and you can look it up online, but is to do breath work. I mean, just a few things that can also help is to do it's called carousel breathing. Okay, where you're just laying on the bed and you're making sure that you're getting your breath work in. That would be good to do every single day, especially because what it's going to do is going to help to set your body up to let the nutrients to take over, and for you to transition out of this period of stress and period of panic. So I think you're going to see a lot of things, really help positively. Another thing is to make sure that you're not getting any outside stress from like we have our cell phones, the EMF protection, of like, are you watching your TV all the time? Are you having that Wi-Fi connection all the time? Because that, when your body's under stress like that, any extra outside environment, like any outside chaos can actually cause it to increase. So in your bedroom, make sure that you don't have, your TV running at night that's getting Wi-Fi, or your phone that's getting pinged all the time. But there's a method called grounding, where you can also, and you can look that up, you can Google that, but grounding will also help to set up the body to not be able to handle the stress. Okay. And when I say stress, you going through this situation, I always want people to know that, one, when you go into the hospital and they don't diagnose you with anything, and they say, you know, they put it up in your mind that there's nothing that they can do to help you, and you're just a little bit, because when, like I said, menopause its root word is crazy. Okay. You don't have to feel like that. Okay. And these products can help you do that. And the extra things, you're already doing the clean eating, you're already doing several of these things. Adding grounding and breath work will be just the icing on the cake that will also help you get through this transition.
And de-stress helped me a ton when I was going through a change. Oh, I didn't mean to do that. So 2 more questions, I think. Tammy wants to know, if it isn't too off track, I want to hear Dr. Laura's thoughts on the GLP product. Do you have time for that?
Yes, I love that product. You guys, I love it. It has changed my life. Okay. And I just feel better on it. I'm losing weight. Weight loss is a benefit. Okay. I never, because I eat healthy and I wasn't eating enough protein, which I understood that from Sanjeev. And so I have a beautiful shake called TMR that helps to get the protein in. But, I'm sleeping better. You guys, I don't get up to go potty at night. Okay. And I was getting up once or twice to go potty. I'm not getting up. I mean, I'm lasting until 6 o'clock in the morning, and I'm getting up at 6 o'clock ready for the day. I mean, my energy is so good. And, just be faithful on it. The way I take it is I do my fiber in the morning and I usually have breakfast around 10 or 11. And then I have a meal around, 3 or 4 o'clock. I'm doing my shot or my YGY activate before that meal. And you guys, you're going to eat less. You cannot, I mean, it's just, and here's another thing that I love about it is the food noise. You guys, I went through the holidays and I was losing weight. Okay. My mother's stuffing, dressing, whatever we want to call it, has always been like, I mean, and I'm like, I didn't care about it. I mean, and I never do sugar, so that wasn't a big deal for me. But the food noise is gone. And so, and here's what food noise is. If you're driving down the road and all of a sudden you see a sign that says Cane's Chicken or, something like that, that's food noise if it causes a reaction in the body. I don't have that. I mean, I have to force myself to eat protein because I know how important it is. There's no way you can do it without having that protein and fiber. And so, but no, it's a beautiful, here I am going again. It's been formulated very beautiful. Okay. It's a beautiful system. I love it.
Awesome. Thank you so much for sharing that. And Jen, you had your hand up just a bit ago. Do you still have a question?
All right, thanks, Becca. I actually wanted to speak to, I don't know whose question it was, who asked about the ingredients and the fillers and things like that. I just wanted to offer to your whole group and whoever wants it. I mean, I'd have to send it to one person. I can't send everybody the email, but I've put together an email that addresses this concern with things from Steve Wallach, Richard Renton, Dr. Glidden. And so I can send it to whoever. I can send it to you and Dr. Laura if you want. But I just wanted to say that, these questions that we get as distributors and coaches around the quality of these products, I mean, unfortunately, I understand it, but people really need to understand that's not the main thing. People get so caught up in what is in there as some little filler. These products are light years ahead of anything else you're going to find anywhere. And the fillers that they use are literally as much as possible, or whatever you want to call them, coming from excuse me, natural sources. So I have, over the years of doing this for a very long time, put together this email that addresses that. So how do you propose I
Please.
get that? What do I do?
Please send that to questions@dailywithdoc.com.
You
And
got it.
folks, if you would like to get that email us also questions@dailywithdoc.com, and we will forward that email to you. Thank you so much, Jen.
You are
That's
Thank you,
one thing I
Jen.
love about our community, Dr. Laura.
I love it.
is
And
how
you
we
know, and
all work
people
together.
do get those questions. And so that is awesome that she put that together, because you know, I know the older products had some fillers in it that, you know, people wouldn't like, but you know, not the newer ones. And so they're very clean. You guys, they work really hard. Longevity does.
Yes. Yes, yes. And one more, Hattie's wanting to know, she says, I have many clients that are all women with COPD or asthma. What would be your response to that one?
Okay, so you know, one is cardiovascular, even though you're thinking about the lungs. Okay, and so you want to get on the Healthy Brain and Heart Pack. And one product from my line it's really weird, but it's called Stay Thin. But it has things that tries to get stuff out of the bloodstream. Okay, so it tries to attract to fat, but it also helps to open up the airways. Okay, and so that's another product that you can use called Stay Thin. And definitely you want to do oxygen support. We got the Oxybody Cherry Berry. That is a great product to help with oxygen. The Hope product from the Stay Natural line helps to increase oxygen, plus also clean out the blood. And so those are two additional products, and always go to the ZRadical as well. I mean, it tries to clean up the blood. And so you want to do the Healthy Brain and Heart Pack, Stay Thin, ZRadical, and Hope. Those would be my key products that I would use for that.
And what about gluten with asthma?
You guys, gluten needs to be out of your diet completely. I mean, I know people get hung up on, you guys, it causes so many conditions. I mean, it causes inflammation. And so gluten, I mean, everybody that's on here has got to make that decision. And I know I'm putting people on the spot, but if you're still eating gluten and you're not seeing the results that you want to see, it's because you're eating gluten. You guys, it's very inflammatory. From respiratory to the edema that we were talking about to metabolically, it really does a number on your body with metabolic syndrome. That could be the reason why you're not losing weight, joint pain, every type of inflammation, it can be gluten related.
Yeah, let alone, I mean, you've got gluten, the protein, but you also have the carbohydrates that come along with it that then jack the blood sugar. Patty has her hand up. Patty, did you have any addition to add to your question or comment? Go ahead and unmute yourself. You know, this is reminding me when we would have Dr. Wallach on for 2 straight hours.
Awesome.
It's just so many questions. And I would love to have you on talking about the Stay Natural line, just in general. So let's put that on the calendar as well. Patty, I see you got unmuted.
Yes, thank you. It's funny when you can't find that mute button. So, Dr. Laura, listen, I don't know what I did, but for the last 2 days, I have been dizzy as heck. So my ability to function has been limited, but I don't know what I did or what's going on. So could you?
Do you have any? Do you have like anything happening, like any sinus things, like the weather here?
Oh yeah, that's what it. You know what? Yes, and I noticed that whenever I blow my nose, I'm dizzy.
I would, you know, dizzy is something that you shouldn't shy away from. So if anybody's on here, I mean, you know, it could be cardiovascular, it could be, you know, but Hattie's been on the products and been a health coach for a long time. So that's the reason why I asked her if she had like anything happening, sinus up here, because that could be what is causing it. It could go into vertigo, which, you know, so I would definitely do like the neti pot. If, you know, make sure you guys, if you do a neti pot, that you do distilled water, because you don't want any bacteria in, do not fill it from your sink. You must do, but you can put colloidal silver in the neti pot. which is really good to help clean out the sinuses. We have the Good Herbs Sinus Support product that you could also reach for. Any antioxidants, Stay Young, Cell Shield RTQ. Those are the top 2 antioxidants that I tend to go to. All of that's going to help with the allergies. Now, digestive, probiotics, more good bugs versus the bad. And so if you have that, Hattie, I would definitely reach for that as well. Pollen Burst is a really good product for people that have allergies. And then also my Stay Energized Plus can give you that same, because it just opens up the airways too, as far as that goes.
I did not know that about the Stay Energized Plus.
It's really good with allergies.
Yeah, I have it in my little, oh, not that one, this one, in my little container here. So it fits right into my purse anytime I need it. Thank you. Thank you. Thank you. Dr. Laura Dennison, folks, naturopath, master herbalist, and just a wealth of compassion, experience, and just bringing it to us like it is. I appreciate just the whole resonance of your heart.
Thank you.
As you
you are doing
match
amazing
ours.
things, and your team is amazing. And so, it's just a good community that we have with Longevity for sure.
Yes, we do. Yes, we do. We have one more question. Joanne, can you unmute yourself, please?
I have a question about the sciatic nerves.
Okay, sciatic nerve, and I've had that before, and it could be very painful. Okay, and so you definitely want to do the 9 essential nutrients first. Get off gluten. I mean, that's another thing that causes inflammation. Okay, then we have also with the sciatic nerve. Okay, there's also some exercises that you can do. Okay, you roll up a towel, put it underneath your hip, and you roll on it. Sometimes you get somebody that can actually push, because they have to release that pressure that is around the sciatica. Okay, and so so doing different exercises, which you can Google that, you'll find something that you can do for that. I also like doing the Stay Restored, which is a pain reliever, and then you also have to go to the nerve support. Okay, which is going to be there's a few that we can pull from. One, we have essential oils that I like, the cypress oil. So cypress, and you can put it with the trauma oil, with the CM cream, and you can topically put it on the sciatica to try to help with that pain, but it's also going to help with nerve support. ZRadical is going to help, at the cellular level. Like I said, the Stay Restored for joint pain, but the 9 essential nutrients, and then do the topical, and then also do the exercises. It's one of those that you have to be patient with, because it is something but it's something that you got to do every single day. So like if you're going to use the trauma oil, you need to do it every single day until you can get that released.
And I just want to do a little note with the essential oils. Longevity's essential oils are pure and powerful, especially that trauma. It does not take a bunch of drops, nor do you want to put either of those two directly on the skin. Use that CM cream that helps drive it in. It's just absolutely amazing all in itself. But absolutely, I used what Dr. Conway, so
Okay,
Dr. Laura Dennison, I'm so glad they're friends.
I love Joanne. She's one of my best friends. So you can call me Dr. Conway.
We had her on this week as well. So we had a double blessing this week. Oh, cataracts.
Okay, cataracts, you guys, is it goes into deficiencies. And so, but it relies on things that cross over the blood-brain barrier. So the 9 essential nutrients, I would do the I would do the BTT 3.0, because it does have more antioxidants in ORAC value. That means it's going to get to the area better. Then you also have, we have in the Pro line, we have a product called Ocutive. That's a really good product for the cataracts. And also in the Stay Natural line, the Stay Young. Those two would be really helpful to use. So the 9 essential nutrients, which cataracts and eye health, is very important to make sure that you're taking products that have a high ORAC value. And so that's the reason why I would do the Rise and Restore in that. But then also the Stay Young and also the Ocutive. You guys, Ocutive is interesting. Is Steve Wallach developed that product, and he had extreme dry eye, and I've had extreme dry eye. Okay, my whole life, and it actually is related to hormones. Okay, but he put ingredients in there that also helps with extreme dry eye. So it's really an amazing product.
Excellent. Good to know. And Dr. Laura, you do a call called Let's Talk Products every Wednesday night at 6 p.m. Central, correct?
Well, and I have been doing it every 2 weeks. Okay. And so, but I'm going to, people have been requesting that I do it weekly. And so I will be getting in February, go back to the weekly. And yes, it is 6 Pacific, 8 Central. But it's an hour long. Let's Talk Products. I pick up a topic, and you guys, even though I brought over the Stay Natural brand, I love talking about products, and so I talk about all brands of longevity products and all brands.
Awesome. And how can they get information on where to go to access that call?
Okay, so I just developed a new professional Facebook page, and that's where I'm posting everything. And so just go to Laura Dennison, ND, naturopathic doctor. And so that's my new Facebook page. And I post everything on there. I'm even, like last week I did a whole series on the GLP-1. This is information that you can use. I mean, if you like it, you can share it. I mean, it's a safe place. It is an educational place. Next week, since I was doing hormones, I'm going to do a whole series on hormones next week. And so, but it's just information. It's not live or anything like that. It's just, stuff that I have in my arsenal that I like to share. And so, but
awesome.
You can go to the page.
Wonderful, wonderful. And folks, again, that's on Facebook. She has a professional page, and that was Laura Dennison, ND.
Correct. Naturopathic, and then it's /naturopathic doctor.
/naturopathic doctor. So definitely want to make sure that we look for that and get plugged in and follow, because she does have amazing, amazing presentations where she is talking product, and she does the whole arsenal for lack of a better word. Well, if I could get the co-hosts up on the screen with us today. Yeah, we went over time. Thank you so much, Dr. Laura, for spending this over an hour and a half, almost 2 hours, because you come on early and we do some little chats. We greatly appreciate you, your time, your wisdom, knowledge, your heart. You are just absolutely a gem when in this whole community and industry. Folks, I hope that you're feeling the love. When we're having these presentations and we're bringing in these individuals, they have hearts to help people. And that's what our whole community is all about, is we want people to understand they are empowered. They have the ability on their own to nutrify their body and let the body do what it was designed to do. So thank you for taking this time and investing in yourself. Share this program with others. Make sure that you subscribe to our channels if you're watching one of the platforms. And again, on those platforms, you can look in the description and get information about what is being spoken about today. And the best places to get the products is you want to make sure you're getting quality, genuine, not pirated, and fresh. So get back with the person that shared this program with you. Don't use those big box places or even online retailers, because you want to make sure that you are also getting a coach and somebody that can be by your side on this thing we call a health journey. And folks, U-turns are always allowed. So until next time, I just want to do a shout out. Dr. Laura, again, thank you so much. And here on the co-hosts today, we have Albert helping to let people in. We have Marilyn and Phyllis both doing a fantastic job putting information into the chat, helping you get that information in black and white so that you can write it down. Thank you, ladies, and AJ, thank you. And also the team that is bringing in those questions for them out on the different platforms. Have a fantastic day, folks. And don't forget how empowered and divinely created your body can be. Visit dailywithdoc.com, or if you want to get with a health coach and you're not working with somebody, 855-949-3377. Bye for now. This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Statements in this program have not been evaluated by the FDA. As an empowered individual, you do have options available. We're honored to continue and share the teachings of the founding father of science of epigenetics, Dr. Joel Wallach. This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Statements in this program have not been evaluated by the FDA. As an empowered individual, you do have options available. We're honored to continue and share the teachings of the founding father of science of epigenetics, Dr. Joel Wallach. This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Statements in this program have not been evaluated by the FDA. As an empowered individual, you do have options available. We're honored to continue and share the teachings of the founding father of science of epigenetics, Dr. Joel Wallach.
This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Statements in this program have not been evaluated by the FDA. As an empowered individual, you do have options available. We're honored to continue and share the teachings of the founding father of science of epigenetics, Dr. Joel Wallach. This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Statements in this program have not been evaluated by the FDA. As an empowered individual, you do have options available. We're honored to continue and share the teachings of the founding father of science of epigenetics, Dr. Joel Wallach.